Have you ever heard of a virus that jumps from bats to pigs to people? It sounds like something out of a movie, but it's a real and serious public health concern. Today, we are taking a deep dive into the Nipah virus, a pathogen that has caused significant outbreaks and continues to demand our attention. What is it? Where did it come from? And how can we protect ourselves? Let's find out. The story of Nipah virus begins in 1999 in Malaysia, near a village called Sungai Nipah, which is how the virus got its name. The initial outbreak was linked to pig farms. Researchers discovered that fruit bats, also known as flying foxes, were the natural reservoir for the virus. These bats would drop partially eaten, saliva-contaminated fruit into pig pens. The pigs would then eat the fruit, get infected, and pass the virus onto farm workers. Since then, outbreaks have occurred in other countries like Bangladesh and India, often with a different transmission pattern. So, how does Nipah virus spread? The primary route is through direct contact with infected animals, like bats or pigs, or their bodily fluids. In places like Bangladesh, a common source of infection has been drinking raw date palm sap. Fruit bats love this sweet treat, and they often contaminate the collection pots with their urine or saliva. This is a crucial point. The virus can spread from animals to people. But what's even more concerning is that Nipah can also spread directly from person to person. This typically happens through close contact with an infected individual's respiratory secretions, like from coughing or sneezing, or through contact with their blood or other body fluids. This makes containing outbreaks in healthcare settings and within families incredibly challenging. It's a double-edged sword, animal to human and human to human transmission. Now, let's talk about what happens when someone gets infected. The symptoms of Nipah virus can be frighteningly severe. They usually appear between 4 to 14 days after exposure. Early signs can be quite general, like fever, headaches, muscle pain, vomiting, and a sore throat. These might sound like the flu, but they can quickly escalate. The infection can progress to cause dizziness, drowsiness, and altered consciousness, which are signs of acute encephalitis or swelling of the brain. In severe cases, patients can fall into a coma within 24 to 48 hours. Tragically, the mortality rate for Nipah virus is very high, ranging from 40% to 75% depending on the outbreak and the medical care available. Some survivors also experience long-term neurological problems. This brings us to a critical question. Is there a cure? Unfortunately, as of now, there is no specific vaccine or drug to treat Nipah virus infection. Treatment is primarily supportive care. This means managing the symptoms, providing respiratory and neurological support in an intensive care unit, and trying to keep the patient as stable as possible while their body fights the infection. The lack of a specific treatment makes prevention even more vital. Researchers are working hard on developing vaccines and antiviral therapies, but these are still in the experimental stages. So, the best weapon we have against Nipah is prevention. How do we do that? First and foremost, avoiding exposure to sick pigs and bats in areas where Nipah is known to occur is key. If you live in or are traveling to these regions, a major rule is to avoid drinking raw date palm sap. The sap should always be boiled before consumption to kill any potential virus. It's also important to wash fruits thoroughly and peel them before eating. Practice good hygiene, especially frequent hand washing with soap and water, particularly after visiting farms or markets. For healthcare workers, the risk is significant. They must use strict infection control measures when caring for suspected or confirmed Nipah patients. This includes wearing personal protective equipment like gloves, gowns, and masks to prevent any contact with the patient's bodily fluids. Isolating infected patients is also crucial to stop the virus from spreading within the hospital. Public health surveillance is another cornerstone of prevention. Quickly identifying cases, tracing contacts, and implementing control measures can stop a small cluster from becoming a large-scale epidemic. The Nipah virus is a stark reminder of the interconnectedness of animal, human, and environmental health. As human populations expand and encroach on natural habitats, the risk of zoonotic diseases, those that jump from animals to humans, is only going to increase. Understanding these threats, like Nipah, is the first step toward building a safer, more resilient world. By raising awareness and promoting preventive measures, we can all play a part in protecting ourselves and our communities. Thank you for watching this deep dive into the Nipah virus. It's a serious topic, but knowledge is power. If you found this information helpful, please give this video a thumbs up and share it to help spread awareness. Don't forget to subscribe and hit the notification bell for more important health content. Stay safe, and see you in the next video.